most valuable, but it is also the most expensive, time-consuming, and rigorous, making secondary evidence the least common in medical literature. No study is perfect, but if you come across a review from the Cochrane Library or an article that states that use the Cochrane protocol, you can be guaranteed to get top-level results that your doctors can rely upon with confidence. Hence, doctors and government policymakers who study systematic reviews provide patients and public health agencies with the best quality, evidence-based recommendations because they combine their training, background, and experience with the highest levels of current research evidence available. The following excerpts from CNN interviews with the two top COVID-19 policymakers that follow without using secondary evidence are examples of the lowest pyramid-level expert opinion. We research, you decide.
There's an uptick in COVID cases and a new variant called BA.286, some 3.5 years since the pandemic was first identified. But if public health officials feel it necessary to ask America to mask up again, how many would comply? According to Gallup, in the first 2 years, public confidence in the U.S. healthcare system has dropped from 44% to 34%. Joining me now to discuss is Dr. Anthony Fauci. He, of course, is the former director of the National Institute of Allergy and Infectious Diseases. There is a perception out there by many, how many I don't know, that they don't work and that the data concludes that they didn't work in the first go-round. Respond to that on masks.
Yeah, well, that's not so. I mean, when you're talking about at the population level, that the data are less strong than knowing that if you look on a situation as an individual protecting themselves or protecting them from spreading it, there's no doubt that masks work. Different studies give different percentages of advantage of wearing it, but there's no doubt that the weight of the studies, and there have been many studies, indicate the benefit of wearing masks.
I'm going to refer to one of them. You've heard about it before. I heard about it from a number of radio callers. Brett Stevens in the Times talked about Cochrane. Put that on the screen. The most rigorous and comprehensive analysis of scientific studies conducted on the efficacy of masks for reducing the spread of respiratory illness, including COVID-19, was published last month. Its conclusions, said Tom Jefferson, the Oxford epidemiologist who is the lead author, were unambiguous. There is just no evidence that masks, make any difference, he told the journalist Mayan Demasi, full stop. But wait, hold on. What about the N95 masks as opposed to the lower quality surgical or cloth masks? Makes no difference. None of it, he said. Well, what about the studies that initially persuaded policymakers to impose mask mandates? They were convinced by non-randomized studies, flawed observational studies. How do we get beyond that finding of that particular review?
Yeah, but there are other studies, Michael, that show at an individual level for individual. When you're talking about the effect on the epidemic or the pandemic as a whole, the data are less strong. But when you talk about as an individual basis of someone protecting themselves or protecting themselves from spreading it to others, there's no doubt that there are many studies that show that there is an advantage. When you took at the broad population level, like the Cochrane study, the data are less firm with regard to the effect on the overall pandemic. But we're not talking about that. We're talking about an individual's effect on their own safety. That's a bit different than the broad population level.
CNN's Dana Bash tried to get CDC Director Walensky to explain her mixed messaging regarding who needs to be masked and who doesn't.
Yeah, and I understand what you mean about a first step, but can you see, since this is big news for every American, can you see how your guidance that vaccinated people can take their masks off, but requirements from businesses, local governments to keep the masks on are sending a mixed message?
Here's what I know. I know that we need to do the hard work. This was individual guidance to understand what this means for communities, what this means for businesses. We know at the individual level, the vaccinated people are safe. More than 1/3 of Americans have been vaccinated, over 45% of adults above the age of 18. Those people are safe. when they get vaccinated, after they're fully vaccinated. For those who are unvaccinated, we're really asking those businesses to work hard to make sure that they have available vaccine for those people so that they have time off, so paid time off, so that they can get their employees vaccinated. Mm-hmm. And for those people, we really are asking them to get vaccinated or wear masks to keep themselves safe.
Hey everybody, Greg Schmades here. I'd like to talk real briefly and help you walk through the evidence on mask wearing. I think this is really important. I'm here in New Mexico. Our governor just mandated another time for mask wearing for people indoors. And the CDC, as well as some other sources, are claiming to have evidence to wear masks. And so as an evidence-based physician, I'm indifferent to wearing a mask or not. I wear a mask all day at work anyway as a surgeon, and I just want to do what the evidence shows. The evidence I've seen is overwhelmingly in favor of saying that masks worn by the general public out in public places, they don't work. And so I was confused as to why the CDC claims to have this data. So I just thought real quick I would run you through some of the data in just a couple of minutes to help you have, I'm not trying to convince you of anything, I want to help you have intelligent discussions with people at your workplace and your family. And so I just went to right here, the live CDC website, okay? It's entitled Science Brief, Community Use of Cloth Masks to Control the Spread of SARS-CoV-2, okay? And let's just go to their very top study. So this is their website. You'd kind of think and assume that maybe their number one listed study would be some big prospective trial and follow up on patients and testing people for COVID. And I it's hard not to kind of laugh here. This is their number one paper that they cite when they claim to have evidence that masks reduce COVID transmission. An investigation of a high exposure event in which two ill hairstylists, and that's CDC's number one top paper that they cite to claim that masks work. Number two, 124 Beijing households. I'm just reading straight from the website here, okay? 124 Beijing households. And then down here, a retrospective study on an outbreak at the USS Theodore Roosevelt. I actually took the time to look up that paper and read it. It was self-reported from the 382 U.S. Navy people that were on that aircraft carrier, and they was just self-reported on a piece of paper. Did you kind of wear a mask or not? And that was it. Okay, so that is the data right here that they're claiming. They have a list of, they just have a paragraph here. You can go to the website, Google it yourself, of supposedly all these studies, and they have a table that goes down. I'm going to switch the camera over here so you can see this. This is really important because in public health, look at this, just the month of May, the month of March only, February to March, April to May. Here's a bigger one, January to August, but all this study is just when Arizona had this mandatory mask wearing, and it's a temporal association. So I mean, they have no proof that COVID cases would have changed during that time, regardless of that. It's just an observational study. So in public health, the problem with what the CDC is doing in listing these studies is that they have these studies that are just a few months of a snapshot of what the virus is doing. That's not how we do public health. We're talking about long-term data. You can't just cherry pick a few months. And so the study that I like to cite is the Denmark study. And I'm going to wrap this up. This is the very, very important point when we have this discussion. If you scroll up on this website, once again, the CDC's live website where they claim to have this data, they actually attack the Denmark study that I like to cite. Remember, this is the authoritative study where they designed the study from the get-go and then performed the study prospectively. That's very important. In medicine, it's considered a lower level of evidence just to look back on the past and say, let's try to gather the data. If you design your study from the get-go, it's much more high-quality data. Here's what's important, and this is very concerning to me, very concerning. The Denmark study was 3,030 people. 3,030. And if you read on their website right now, and I quote, okay, the study was too small, end quote. That's what the CDC says. It was too small. And the studies that they cite on their website, 382 U.S. Navy men and women, 2 hairstylists, 124 Beijing households. And they're saying that the Denmark study was too small. That, I don't know. I don't even know what to say about it. It's just, I think maybe they don't think people will actually go through and read these papers. I really don't know. But now this is a nice review of what the CDC is saying. We've got to think critically. I want to reinstate trust in the CDC. We need the CDC in America. We need sound science and academic inquiry. So please go over this website with your friends and family, with your coworkers, doctors, get into the hospitals, go talk to your patients about this, please. Hey everybody. Greg.
What is it about humanity that wants to go to all the details and stuff and listen? You know, these guys like Fauci get up there and start talking. You know, he doesn't know anything really about anything, and I'd say that to his face. Nothing. The man thinks you can take a blood sample and stick it in an electron microscope, and if it's got a virus in there, you'll know it. He doesn't understand electron microscopy, and he doesn't understand medicine, and he should not be in a position like he's in. Most of those guys up there on the top are just total administrative people, and they don't know anything about what's going on the bottom. You know, those guys have got an agenda, which is not what we would like them to have, being that we pay for them to take care of our health in some way. They've got a personal kind of agenda. They make up their own rules as they go. They change them when they want to, and they smugly, like Tony Fauci, does not mind going on television in front of the people that pay his salary and lie directly into the camera. What is it?